Good morning, everyone. It's lovely to be here. My name's Rosemary, and I thought I'd tell you a few stories about journeys through medicine taking. And these stories actually come from the research that I've been involved in, conducted together with people living with dementia, family carers, healthcare professionals, and also people who support people with dementia. So journeys. Well, we've all been through journeys. Some journeys are rather easy, straightforward, uneventful. But some journeys can be rather difficult. Some may say it's a lot of pressure. Well, some journeys are short, and some journeys just go on, and it just doesn't seem like there's an end in sight. Well, I remember a car journey last summer with my two little sons. Well, we were driving to the west of France, and boy, that was a rather long and interesting journey. No doubt there were lots of ups and downs, but to me, that was a good journey. So have you ever wondered what made a journey good and what made a journey difficult? What were the circumstances that led to the different outcomes? And really, these were the types of questions that started us off in our research in dementia and medicine taking. So we know that people living with dementia and family carers can sometimes experience difficulties managing their medicines. It can be quite difficult to keep on top of everything that is going on with our medicines. So think about the appointments at the surgery, the clinic, the hospital. Think about the ordering of medicines, collecting them, going back to collect the ones that have been out of stock. When you bring them home, where do you store them? And thinking about when should I be taking them, how should I be taking them, which order should I take them, well, and the list goes on. And this was the same with Brian. Brian lived with dementia, and he noticed that the medicines, the pills that he collected from his local pharmacy seemed to change in color and also in appearance month after month. And unsurprisingly, this caused confusion. And so he brought this issue to his local Alzheimer Society empowerment group, who then told us about these issues. And to me, Brian's experience highlighted the importance and the value of sharing stories, or sharing personal accounts. And in the next few slides, I'm going to tell you some of the stories that we heard from the research participants that participated in our research. And really about their challenges, managing medicines, and also, quite importantly, what did they do to make their journey easier? And the study that I'm going to talk about was really influenced and inspired by Brian's story. So one of the things that people with dementia experience is a deterioration in their ability to plan, to execute, and to undertake specific tasks. And this is the same with medication. Well, some people manage better than others, but more often than not, people with dementia manage by letting others help them. For some people, getting help is not an issue, but for others, letting go and giving up control can sometimes be quite difficult. In some situations, it's a situation where control is taken away from them, and that can be quite hard. And sometimes it causes considerable stress for both the person with dementia and also their family carer. We also spoke to people who live on their own and have dementia. And for some people, actually, they want to have the help, but they don't have the help that they want. So here we hear different types of experiences and journeys. What other people found challenging also is a complex medication regime and a new medication regime. So we know that over 90% of people with dementia have at least one other health condition. So for example, heart disease, depression, painful conditions, and they're prescribed medication for this. So this means an increased number of medicines, which can then lead to a complex medication regime, and also new medicines. And what this happens is that it can influence how people take their medicines. So we know that the more number of medicines are prescribed, it becomes more difficult then to adhere to the therapy, or in other words, to follow, to take the medicines as prescribed by the doctor. And there are also other factors that can influence how well people take their medicines. So this is a quote from a family carer, and he's telling us here about his experiences looking after his wife. So this is what he said. He said, "My wife is on a lot of medication, not only for Alzheimer's, but also for asthma, COPD, thyroxine, quite a repertoire of pills. And some are pills, some are inhalers. But pill boxes don't really work for inhalers, so it's not suitable to have a pill box for an inhaler. It was very challenging for me to keep track of everything." So what this person has mentioned is a pill box. Pill boxes are what we call compliance aids, generally designed to help people organize their medicines. And as the family carer rightly pointed out, there are some limitations to compliance aids. And here are some pictures of compliance aids that our participants took. So you can see generally that they are really designed for tablets or capsules. So if somebody is prescribed tablets or capsules, then this type of compliance aid might work for them. But we know that there are different forms of medication as well. People may be prescribed creams, inhalers, patches, eye drops, ear drops, all sorts of different things that actually don't fit here. And so what happens is that people might have different systems to organize their medicine. So they might have a pill box, but they might put their inhalers and their creams and things somewhere else. So it can be a little bit tricky to manage that. Another way that people manage medicines is establishing routines. So some people like to take their medicines with meals. So for this person, it's with breakfast. So it works for some types of medicines, but we know some medicines shouldn't be taken with food. So again, there are different ways that people will have to adapt. Some people have monthly routines, so going to the pharmacy every month, so it becomes a part of their life. People also use visual cues, so notices on whiteboards. We have here an example of sort of a time and day clock, and also then strategically putting medicines in places where they're going to see it every day. Some have developed their own checklists, so as they take their medicines, they would tick off the relevant boxes. Some use alarms to remind them to take medicines. These two are technology. So some use specific types of technology that provides feedback that then help them to place themselves within time and place.
The time is 12:47 p.m. Today is Wednesday, April 12, year 2017.
So this is an example of a talking clock. So it tells you the time and the day, the date as well. So it helps people to locate themselves. They know what today is what day. And then on the right, I think some of you will be familiar with Alexa that gives you feedback. If you ask a question, it tells you, gives you an answer. So that helps them as well. Sometimes the family carer is the reminder. Well, family carers who primarily take on the role of medicines management sometimes use existing services within GP surgeries and community pharmacies. So they may request their prescriptions online or use the community pharmacy prescription collection service, home delivery. So these are some of the things that people have used. They've also told us that communication with healthcare professionals can sometimes be a bit difficult, especially when there's complex information, or sometimes to make an informed judgment about a particular situation. And so people, well, generally the family carers would then take the initiative to contact the healthcare professionals. Some have developed contingency plans, so like a folder or file that has everything, all the information about their medical condition, their medicines, everything in a specific location. And that is quite strategic because they are trying to plan for situations, for emergencies. And so from the stories that we've heard, what we can understand is that medication management is a complex process. So sometimes people have a rather easy journey, but that can soon turn into a rather difficult journey. So an infection, a fall, as we heard from Rick, can quickly change a situation. But from the people that we spoke with, most of them, all of them, were very resilient and they continue to do the best that they can. Well, one of the observations that I noted from our study is that the type of help, the support that people got about medicines management came primarily from themselves and also from their family carers. But what seemed to not be mentioned as much is the role of healthcare professionals. And this is rather surprising because healthcare professionals are integrally involved in all aspects of care. And so what we wanted to do is to try and understand and map out the medication management process. And the following video, I'm going to show you a video, will just show what we did.
So I'm so glad that I'm here to still continue to see the progress of the research.
I found it very useful to have to hear the opinions of all the different professionals, carers, relatives. It was really good to get everyone's opinion and try and map out the process.
That if you've got an advocate, then your care will be much better than if you haven't.
The discussion has been a lot about how important it is that information is shared in the right way and at the right time.
But the way that the workshop was delivered and presented allowed it to be mapped visually.
We've highlighted that communication's a major issue. We've highlighted that teams need to work together. But above all, I think it's something about understanding the epidemiology and the numbers of patients that are going to become older, have dementia and hit a variety of services.
Today has been really eye-opener for dementia patients about medication management. I think it has opened loads of doors for us to look into.
I think what really struck me was how diverse the opinions are and how complex the system is, and how actually we do have a lot of work to do to make patient care safer for people with dementia and also their carers. So that's just a sort of little video showing the kind of work that we're trying to move towards. And following different studies that I've conducted and also existing research, we have identified quite a few specific research areas. And one of these is, as highlighted in the video and also in the results that we had in the previous study, is communication. Communication between healthcare professionals and people with dementia and their carers. And actually, community pharmacists are strategically placed to offer this kind of support. So one of our ideas is to develop an educational resource for community pharmacists to enable them to conduct effective consultations with people with dementia and their carers about medicines, so that they can then help work together, work collaboratively to support people managing their medicines. So just to close, I would just like to acknowledge these organizations and also these people who have helped us in the research that I talked about today. Thank you very much.